What's going on, everybody? I'm Dr. Pete. This is Thompson Healthcare and Sports Medicine. I'm a physical therapist at the Toms River branch. This is my patient, Jen. Jen is currently rehabbing. She has bilateral shin pain. It first got aggravated a couple weeks ago during track, and we've been really working on her range of motion of her ankles, her strength of her hips. And what we're going to go over today is a quick assessment for athletes like Jen to gauge their range of motion and strength with the overhead squat assessment. So the overhead squat assessment, it provides a lot of information for athletes gauging their range of motion and strength. There's three basic things you want to look out for. Number one, can the athlete maintain a neutral spine and stabilization throughout the entire range of motion of the squat? Two, does the athlete have enough rotational capacity to activate the muscles to help support the joint throughout the range of motion? And then three, while introducing weight, like a weighted ball, can they maintain that neutral spine? So what I'm gonna ask Jen to do, can we have your feet hip-width distance apart, hands up in the air. I just want you to bend down into a squat as far as you feel comfortable. Pretty good, just keep doing it just like that. So you could do two approaches. You could work from top down or bottom up. I always like looking at the hips first. Jen's doing a great job of first hinging at the hips, then bending at the knees. You never want to squat bending at the knees first, because that puts a lot of pressure right along all those ligaments. You got your patellar ligament, which is right in the front part of the knee right here, and you got your ACL, your MCL, which is on the inside, and then crosses over towards the outside part of the knee. You could take a break right there, Jen. Great job.
Thank you.
Another spot you want to look after is the ankles. So let's do another squat when you're ready. Take your time.
My hands up.
Hands up. There you go. Let's bend down. Very good. Now I want you to notice right there, see how Jen kind of lost balance a little bit? That could be due to some of the rotational capacity of her hips. Let's make a quick adjustment. What I want you to do, you're going to place your feet down. I want you to pretend that your feet are dinner plates.
Okay.
You're going to twist your knees outward and really plant your feet into the ground. And do the same motion as before. Very good. So you already noticed that her foot wasn't as wobbly and she had a little bit more stability going down to the bottom depth of that squat. So two key points that you always want to target when doing the overhead squat section. Okay, so we went over doing a squat without weight. Now we're going to add some load to see if Jen is able to maintain that neutral spine throughout the range of motion of the squat. There you go, hands above. Let's bend down. Excellent. Now you can see that Jen is kind of leaning a little bit forward when she's going down in the bottom of the squat. We're going to make a quick adjustment. Let's have that load above your head, just like that. Now I want you to turn your elbow pits forward. So twist forward towards me. Very good. A little bit more like that. So what that does is going to activate all this back musculature to help support the shoulder joint throughout the motion of the squat. Let's try that one more time. Better. How did that feel in comparison to the last rep?
I felt it more in my back.
More in your back. Excellent. So she's getting a little bit more support from the muscles and less at the shoulder joint. All right, everybody, thanks for watching. I want to thank Jen for being a great patient, and we're really killing it in her rehab. So take care.